Hi, everyone. This is Eric Glazer, and welcome to Bright Spots in Healthcare, produced by Bright Spots Ventures. Our mission is simple: find what actually works in healthcare and help you all scale it. Each episode, I sit down with senior leaders from health plans, health systems, provider groups, and other innovators across the industry to cut through noise, share honest conversations, and unpack proven approaches delivering real results in the real world. This isn't a show for spectators or buzzwords. Really, it's for builders. It's for innovators. It's for the courageous, the ones not afraid to push progress inside their organization and beyond. If that's you, hit subscribe. You're home. This is your Bright Spots in Healthcare podcast. Hey, everyone. This is Eric Glazer. Welcome back to Bright Spots in Healthcare. And this episode is a doozy. I sit down with Patrick Quigley. He's the co-founder and chief executive officer of Sidecar Health. Sidecar, they're not trying to negotiate better rates inside the existing insurance model. They are making a more radical decision. They're removing the network entirely and exposing real prices to all of us, the consumers. So instead of insulating members from the cost, they show it upfront. Instead of hiding negotiated rates, they publish them. And instead of controlling behavior through restriction, they actually rewire the incentives for all of us. Most carriers try to manage costs inside a legacy structure. This is totally different. This could be a brand new bright spot for you. They ask a different question. They say, what if the structure itself is the problem? So this is a conversation about incentives, transparency, risk, and what happens when you make healthcare behave more like a market. So if you're a health plan leader, you're an employer, an investor, policymaker, solution provider, listen closely. This is a structural conversation, not necessarily what I call a cosmetic one. So enjoy this incredibly enlightening and interesting conversation that I got to have with Patrick Quigley, CEO of Sidecar Health. So I'm here with Patrick Quigley. He's the co-founder and CEO of Sidecar Health. And from the beginning, this organization made the deliberate choice: don't negotiate inside the legacy insurance framework. Build a new one. What? We're going to get into more about that. By eliminating networks and making pricing visible, Sidecar is betting that transparency doesn't just inform consumers, but it changes the markets. It allows us, all of us listening, to change the markets. Patrick's career has spanned consulting, enterprise tech, and health plan innovation. But Sidecar is where those experiences converge into a structured thesis, a structured Patrick Quigley thesis about how insurance should work. So Patrick, I'm glad we're able to finally do this. We have a long history of talking, but now we finally have you on the episode. Welcome to Bright Spots in Healthcare.
Eric, I'm just so happy to be here. Thanks for having me on.
I was preparing for this episode, and tell me if you like this. I think that you sort of could be the TurboTax of healthcare. So let me tell you why I think that. So I remember when doing taxes was like sitting across from someone or sending your stuff to someone, stack of forms, right? No real visibility into what was happening. You paid a bill, you hoped it was right, and you moved on, right? And then TurboTax comes along and it doesn't rewrite the tax code, right? It doesn't rewrite any legislation. It just makes the system transparent. All of us can access it. It's driven by consumers like us. And suddenly we get to see the inputs. We understand the trade-offs. And now we're optimizing outcomes sort of on that we're driving. And I feel like healthcare feels a lot like the old tax system in some ways. It's opaque. It's controlled by experts. And we are completely disconnected from the price tags. So I think the question, like whether you manage around a broken, system or redesign it, like I said, is sort of what you guys are all about. And I wonder if that analogy rings true with you.
Oh, absolutely. Like that really resonates. Hadn't thought about it from that perspective, but maybe our marketing team should. Like at the end of the day, the one thing we can all agree is that the existing system is not on a path to deliver what we all want it to do, which is better outcomes, better care, and make sure it's affordable and accessible for everyone. So whether it's we're trying to fix the IRS system or just staying focused on the healthcare system, there's certainly an opportunity to do better.
Yeah, let's get into that. Let's get into the mechanics of what if a sidecar. Like, what is the single structural design decision that you guys made uh, that made sort of the legacy system, something with the legacy carriers, a decision they would never make? So, what's the single structured decision sidecar made that a legacy carrier would never make?
Yeah, well, I mean, our core principle that makes us very different is we want people to treat healthcare dollars like their own. That's at the core of it, right? So we're not talking about things when you have an unplanned event or an emergency. We're talking about things where you should be making decisions. We want you to have the information you need to make the decisions that you want for yourself, for your family. This is, of course, about price, but it's also about quality and about convenience. So we want people to basically go and engage the healthcare system in the way they engage everything else in their lives. So what we want people to treat their healthcare dollars like their own. We want to make healthcare shoppable for people for these planned events of care.
So, tell me a little bit about how you execute on that. Is that the publishing of pricing? Is it an incentive split? Is it the absence of networks? Tell me a little bit about the design so we could picture it in our mind's eye.
Yeah. Well, let's even start a step back to make sure everybody kind of understands who we are. So Sidecar Health is a full stack health insurance carrier, very similar to any of the big carriers that we all kind of know, Anthem, Aetna, United, right? So in terms of protections and all of those things. What we're different, as you point out, is in the interactions, right? So we take everything that maybe people don't love about their health plan, the barriers to care, we call them, the prior authorization, formularies, step therapies, and we eliminate them all, right? We want doctors to make care decisions, and our job as a health plan is to pay for them. But we accomplish that because obviously, I'm sure for those of you out there that pay for healthcare or employers with your teams, and healthcare is very expensive. So that approach of eliminating all the barriers sounds very expensive. We actually lower costs by 20%. And we do that for the employers, but we do that for the employees as well. And we do that by changing this interaction. So this gets back to your question of how. How do we do it? Well, we make healthcare shoppable. What we've done is we basically have determined a budget for anything you can do in the US healthcare system. And we make that budget transparent to people. We call it a benefit amount. And we allow people to basically make a decision about where they go and how they go engage with the healthcare system. And if they decide to spend more than that budget, just like anything else in our lives, they know ahead of time because they're purchasing it and they know what the cost of that is and they're responsible for it and they value that. And just like, again, your own decisions. Likewise, if you decide to actually save money, spend less than your budget, that money that you save, you actually get to keep. And in our case, you keep half of that money. So that is the fundamental difference in our approach to healthcare. We eliminate networks, we eliminate barriers, we give people money to purchase the care they need with the doctors that they want, and we give them incentives in transparency. It's not just transparency, it's incentives to make the best decisions for themselves and their family in that transition.
Okay, so let's say I have $100 for a PCP visit. Actually, give me a real amount. First of all, actually, before you answer that.
Yeah.
Give me the states that you're in so we can get some geographical reference.
Today we cover employees in 48 states, right? So like we have members everywhere, right? So we sell fully insured, level funded, and self-funded products. So if you're a jumbo employer, like our largest employer is 100,000 employees, like, it doesn't matter where they're domiciled. In the mid-market, we sell fully insured products for the mid-market. And those are state specific. So those are, our first state was Ohio. So companies domiciled in Ohio with employees anywhere, it doesn't matter. Georgia, Florida, Texas. So those are the places we sell mid-market, fully insured products today, but their employees can be anywhere. Does that make sense?
Makes total sense. So I have $100 based upon my benefit design for a PCP visit. And I go online and there's a doctor I definitely want. I see his price is $150. There's a doctor that's 10 minutes from my house. I see he's she's a buck 50. I see someone that's reasonable 15 minutes away and he's 75. So tell me what happens when I go to 150. Tell me what happens when I go to the 75.
That's right. So the way we have a budget. So what's that? Let's talk about what that budget is and how it's set.
So I made it $100 in my particular.
You made it $100. We can use your $100 example. That's fine. I don't think it's $100. Yeah, but anyway, but the first thing is where's that $100 come from? So that $100 comes from is we pay commercial rates. So there's Medicaid, there's Medicare. Commercial rates are higher, right? This is why with commercial rates you have better access. So we pay commercial rates. And in the US healthcare system, one of the crazy things about it is there's no correlation between quality and cost. People don't talk enough about this, but because there is no marketplace for healthcare yet, you don't have a traditional market forces that create this relationship between quality and cost. It doesn't exist. If anything, there's a slightly negative correlation between quality and cost, meaning the better doctors are slightly less expensive. So everyone automatically assumes that their doctor, which is a great doctor, is a more expensive doctor, but they're often surprised that they're not. Right. So we set our prices at the midpoint, basically making sure that the budget for care, that $100 that you mentioned, is at the midpoint of in your market. So if we move into an area, maybe there's 3 hospital systems, we'll pick of those that are serving kind of the commercial community, we'll pick the middle priced one. Right. So that's how we set it. So it is intended to be set so that people have massive access. Right. One of the things we pride ourselves on is the access our product it provides is unparalleled. So back to your example, let's assume for a minute that $100 is the correct amount for the commercial market where you live. And you decide to go to a doctor, not for quality reasons, but for whatever reason that costs $150. So you would know that ahead of time. You'd see it in our app that this particular doctor, you'd be able to see that, hey, if I go to Dr. Smith, it's going to be $50 more than my benefit, and I'm going to be responsible for that $50. And so that is awesome for me because now I have 100% confidence of my interactions with that doctor. When I go see that doctor, no matter what happens at that doctor visit, whether there's an EKG, maybe a lab draw, maybe a vaccine, who knows? We're not healthcare experts. We, as individuals, we don't know what the doctor is going to want to do. But I know for the first time, probably in my healthcare experience, that I'm only going to pay $50 for that interaction. So that's the first thing. Does that make sense?
Total sense. Yeah.
Awesome. So now at the same time, by the way, you also get to see quality ratings. Think about your own experience today. Can you look up and know what the quality of your doctor is? I'm not talking about how nice their waiting room is. I'm talking about do you know what their outcome-based quality is?
No.
You probably don't, right? So nobody publishes out this data. We do. We partner with a group that's spun out of Johns Hopkins. It's an unbelievable company that provides outcome-based data and appropriateness of care data. So we make that data with pricing data available on our app so you can actually see people's price and quality. And it's kind of awesome because you very quickly see that price and quality are not correlated. So let's go back to your...
Do you want to give that organization some run if people want to kind of...
Yeah, it's the company's called GAM. It's an incredible company. GAM stands for Global Appropriateness Measures. So clearly they're scientists, right? That's how they named their company. The data they produce, the product that they have is really incredible. So I'm big supporter of what they're doing. Their mission and their team there is incredible.
We'll put a link into the show description for everyone.
That's awesome. So if you continuing with your example, so I know if I go to the doctor that charges $150, I know I'm only going to pay $50. There's no surprises. That's what I'm going to be responsible for. And then you also mentioned another doctor that in your area that charges $75. Well, what happens if I go there? Well, if I go there in my app, it'll say, hey, I'm going to save $25. So I'm going to earn $12.50. So this is an interesting concept. We're all so focused on what am I going to have to pay and co-pays, co-insurances, if people even, it's hard to understand what those things are. In our app, it literally says, I'm either going to pay $50 to go to the one doctor that you mentioned, or I'm going to earn $12.50. So it's like a negative copay. And so I go to the doctor and I see the doctor and I literally get $12.50 deposited into my account, no matter what happens at that doctor visit, no matter what the doctor charges, no matter what they do.
What do I do with that $12.50? What could I do with that $12.50?
Okay, so great. So that $12.50 actually goes into your Sidecar Health account, and it accrues there throughout the year. So if throughout your plan year, maybe you decide to go to a more expensive doctor or a more expensive pharmacy at some point, that money can be used to pay for something that's above the budget for your given area. So you can
if I go to a specialist that you are giving me based upon the average price $200 for, and it's $220, it's $212.50, I'm all set.
Yeah, so you would use that extra $12.50 and it would just automatically go in that
Yeah.
in that particular case. I love that we picked math here that makes it harder. So that's great job, us.
Yeah.
But here's what's really special. At the end of the year, you're gonna see throughout the year, you're gonna see your kitty grow. Like our average family gets $1,000 cash back a year. Think about that just for a minute. In a world where healthcare costs are becoming out of control, people are having to spend more and more money. The average family on our plan gets $1,000 money back per year on Sidecar Health.
Okay, so that's, by the way, you're teeing me up for the next question, because the design choice changes these incentives immediately. So I want to unpack this. You're already unpacking it. So now that I know the price signals, walk us through how now, with those incentives, how the member, the employer, the provider, all now behave differently. Tell me a little bit about the behavioral change you're seeing with your members, with your providers, with your employers.
100%. This fundamentally changes behaviors across all three. It's great to highlight that. So let's start with the person, the member, the patient, right? So now I'm not just going to the hospital and following the blue line. I am now engaged in my healthcare decisions. I have a reason to care, right? And so the behavior change, one of the first pieces of behavior change, which I am most proud of, is the utilization of care increases, right? We see our members use more primary care because they no longer have barriers to that care. We see our members use more mental health coverage, right? All of our members pay for care directly with the doctors they're choosing with the Visa card we give them. It turns out everybody takes Visa. This is especially true in mental health professionals, right? So the first behavior change is people no longer are fearing going to the doctor. They're no longer delaying care. So they're getting more care. By the way, they get more care and they stay out of the emergency room, right? Imagine a world where you're getting the mental health care you need. You're getting in to see your doctor. You don't end up in emergency situations. You don't end up in the emergency room. Like similarly with doctors, right? Like, so we set up with pharmacy, we set up our benefit amounts. So every drug approved by the FDA is available to our members at no cost. I'm going to keep coming back to that. At no cost. So what do people do? They take their prescriptions. They don't end up in the emergency room. So the care journey here is really one of the major changes for the person. The second major change for the person is the decision making. So I'll make this about me for a minute. So I am on a statin. So I have high cholesterol. I've got a whole genealogy of my whole family's high cholesterol. So I'm on a statin, and I'm not going to pick on any particular pharmacy, but like there are pharmacies that we all know that, like, for my statin might charge $112 to fill my 90-day supply of a statin. So I can go there, I can fill it, or I can fill it at Kroger for $10. And so my budget in my area is $35. So I can go to, the big pharmacy that's overcharging me, and I know ahead of time that I'm going to be paying $70, $80, or I could go fill it when I fill and get my groceries, and I can actually pay $10, save $25, and get paid again $12.50 to make the math hard. So the change in behavior is we see 75, 80% of our members not filling their drugs, or more importantly, filling their prescriptions at low-cost pharmacies. Because there's no difference between a drug at one store versus another store. It doesn't matter. So that's a behavior change.
Yeah. You get what you incentivize, which I think is, that's a Warren Buffett quote. And it sounds like you're just taking that and bringing it to healthcare for the first time and making it, I mean, not for the first time. There are different ways of incentivizing, but the gold standard of providing an incentive to drive real outcomes, it seems like, which is another Warren Buffett or Charlie Munger quote, is what you guys are doing now to the nth degree, which I really like.
Yeah, I mean, look, we've known for years, decades even, that consumer-driven healthcare is going to be the path. This is why HSA exists. We just stop short as a healthcare system of putting the incentives and transparency in place to make that work. So what Sidecar Health has done is simply achieve the vision that the whole industry has had, which is let's empower consumers, let's give them a reason to care, let's put them skin in the game, and that's going to change the outcome. Well, we're just the first company that's actually doing it at a health plan level scale. And so that's the bigger employees see.
All right, this is super exciting. So, all right, here we go. What happens now? So this only works if the members trust the numbers they're seeing and they don't show up at a doctor's office and they think that this person, like my person's 75, I think I'm getting $12.50 back, and I find out that they're 175. So you're pricing data on essentially every provider. If the data is wrong, the whole thing kind of collapses. So what has to be operationally great? Like, what do you have to be doing for price transparency to really work? Tell us what's happening sort of under the hood here.
Yeah, and this is a really important question because you're right. If the pricing is wrong, it could collapse in on itself. And this is where you have to separate out two things. How does it work for the plan, and how does it work for the employee, for the patient? So let's start with the patient, because that's what's most important. Everything that we do at Sidecar Health provides a pricing guarantee for the member. So to use your example, you see that I'm going to select this $75 doctor. I know I'm going to save $25 and get paid my $12.50, right? So I think that's what's going to happen. I go to the doctor, and because of whatever reason, that doctor ends up charging me $175. What happens to me? What happens to you is exactly what we said. You still make your $12.50. It doesn't matter what happens at the doctor's office. It doesn't matter what other services. It doesn't even matter if the services that you planned on were more expensive because the doctor changed their pricing. There is no risk to the member ever. And it's not only no risk on that one interaction, it's no risk for the whole plan year, because we provide pricing data on every doctor in the United States. I want to come back to this and say this again because it should be shocking. We provide pricing data on every doctor in the United States. For the first time ever, you can look up your doctor in our app, no matter where they are, no matter where you are, and understand what their price is. Again, and we also integrate in GAM's quality data, so you also understand quality. So it is a fundamental difference, and you're protected. That price you see is the price you will be either responsible for, or in most cases, because people decide they like getting cash back when going to see the doctor, what you're going to earn when you go see the doctor, and that's guaranteed. So that's on the person side. But you are correct. The pricing can be wrong. So on the back end for the plan. So what we do is, because of all the transparency that has been a force, frankly, since really the early transparency regulations in the first Trump administration, like there is more and more transparency coming out around kind of doctor pricing. So we get tons of data from what's called machine readable files. We purchase tons of claims data on commercial pricing for every doctor. But our members, we don't have contracts with providers. Our members pay directly. And so the doctors can charge whatever they want. So we basically estimate. We have an algorithm leveraging AI. AI has been huge for us to predict what a particular doctor is going to charge. And if we're wrong, that's okay. The member's protected. And what we get is the actual data that doctor charges, and we update it on the map for everybody else. And so
what happens if we think it's 150, he's actually 125?
Oh, well, that's even better, because then it's like everybody wins, because that money then goes back to the member. So we're just protecting on the upside, and we're basically, our members are actually out in the community doing price discovery, and for that we're providing protections. And then when they get the data, the system gets smarter for everybody else. So you and your family are protected and guaranteed pricing. We call it locked-in pricing for any doctor you go see. And then as you learn, we update the map for everybody else. So now that doctor isn't 75, they're 175. I can still go see the doctor, but that's going to cost me $75. I get to now decide if I'm willing to pay $75 when another doctor would pay me $25.
So a big part of this is obviously data and data sources.
100%.
And you guys are a big time live and die on the foundation of data. Tell me a little bit more about how it works with the drugs, right? So a lot of families, it's less about the doctor visits, and it's more about the ongoing 3-month prescriptions that are going on. How does that work with a sidecar, and how do you alleviate the pain there?
Yeah, I think with pharmacy, it's even easier, right? Because of companies like GoodRx, WellScript, there's so many companies out there that are starting to provide transparency to different pricing at different pharmacies, right? And so through our app, we basically integrate in real-time pricing from, I wouldn't say every pharmacy in the US, but like a majority of pharmacies. So you can literally see in the app, like, hey, my prescription is going to be, again, $100 here. It's going to be $10 here. In fact, one of the things that we do with AI is you can actually tell it like your basket of your family's prescriptions, and it will tell you, hey, in your area, you actually should fill your whole basket at this one location, and that's going to produce the most money back for you, even though this one might be a little more expensive at this particular location than in other locations, but your whole basket is cheaper. So because there already is great transparency around pricing data, we can actually integrate that into our app. We're just combining the pricing data that's out there with an insurance plan to give you an incentive to make those decisions.
All right. This is super, super cool. So let's go back, because I think when you remove these networks, there's going to be listeners on thinking, geez, yeah, GAM's fine, but I'm still concerned about quality. And I think that's probably, I think you have probably an undue feeling of security when you're in a network. So I'd probably argue against it. But tell me a little bit about GAM, why you chose the global appropriateness measures for your quality measures, and why you think that's the best way of going about it.
Well, I think that the separating those two issues between like networks and quality data. I think the first thing is when you're making decisions, it's not just about price. Like if you just show price, people are going to make decisions based on price. I think it's really important when you make decisions, you have other factors. You got to think about convenience. You got to think about quality. Like in any kind of consumer decision that we're making, we're not just taking price into consideration. Like think about cars. Like totally. Some cars are expensive, some cars are cheap. Like there's a reason, there's different value being delivered. So it was really important to us in the design of our product. If we're going to change healthcare into a consumer product, if we're going to make healthcare shoppable, it needs to be more than price. So for that, we're not going to reinvent the wheel. Like other people are thinking about quality. So we did a whole bake-off working with one of the national consultancies to help us look at all of the providers that are available providing data. So many of them, Eric, as you know, are actually about cost. They're not really about quality. They're about what's the cost of this care. So
some of them are consumer experience, which doesn't mean quality. It could mean a quality experience, a nice waiting room, and some really polite people, which matter, but it doesn't necessarily mean that clinician is
100%. And like that's actually a really important point. Like what someone's waiting room is and how easy it is to get into them. That is really important information. I would think about that more as convenience than I do how we define quality. But for us, what we cared about was what is the outcome? How appropriate is the care that you're getting? Think about maternity. I want to know if my OB is having more C-sections than is normal for my population. Right. Like I want to know that because I care about that in terms of the decision making that my wife is making for where she's going to go and have care, right? So like that's really important, and we want to make sure that is part of the decision factor as well. So we did this whole bake-off with a number of great companies that surface this type of quality and chose GAM.
God, this is so cool. I'm really loving this. So I gotta, Patrick, I gotta ask. So all of this design thinking and innovation, it usually starts with a moment, right? So it's not a spreadsheet necessarily, it's a realization. So before Sidecar existed, there had to be a moment when you looked at the system and thought, this isn't just inefficient, it's just structurally misaligned. I mean, was there a specific experience or realization that made this whole thing happen for you and for the market?
It's funny to mention it. Yes, clearly. Like I think entrepreneurship oftentimes is personal. Right. And so it did come, the design principles of Sidecar Health came from my own family's need in healthcare and just not getting served well enough for my own kids and being frustrated by waiting lists and hard to get into doctors and not getting access to care. And so that's why we designed Sidecar Health to be so good. Like we like, this is really important to us. But anybody can design an incredible health plan by eliminating all the barriers to care and covering everything like we do. The question is, how do you afford it? And that was a personal experience in my own healthcare journey, getting an MRI, right? And so I did not set out to start the next health plan, right? It just became obvious as I went through my own healthcare journey that there would be a better way. And so I don't know if we've even talked about this or if you're just bringing it up, but I'll just go ahead and mention it that so I had to get an MRI back in 2017, And I was on a traditional network-based health plan with a brand that everybody knows. And I went through my process, and because of my deductible, well, first of all, I went and saw my doctor. I don't know about your experiences. Like the doctor's like, you need an MRI I was having some issues with my back, and you need an MRI. But I can't get an MRI until you do a CT scan. So let's go get you scheduled for a CT scan. We'll do that, and then I'll get the results, and then we'll get you an MRI. So that took a couple of weeks. Has this happened to you? Like as well?
Totally. All the time. Yeah. I've gone through it just recently, once with myself, once with my father. Yep.
Yeah. So you know this journey. So I went and got the CT scan.
Everyone does one.
And then it took about 2 weeks to get through that whole process. And it's like, my doctor's like, yeah, you need an MRI. So then I got prior authorization for my MRI. And then I was able to schedule the MRI and went and got the MRI. And then I got the bill for the MRI. And the bill was $1,300. And so where I was on a high deductible health plan, where I was on my deductible, like I didn't know it was going to be $1,300, but it's my responsibility to pay it. So I felt fortunate that I could pay the $1,300 because that's a ton. So I paid the $1,300, and then went on my way. About a month
Then
later,
you started hammering the healthcare system because the deductible was almost used.
I wasn't smart enough at that point. Look, so many people in healthcare are just resigned to, I guess this is how it works.
Yeah.
Like, I didn't know what bill I was going to get. Frankly, Eric, I was happy it wasn't higher at some point because like you hear these horror stories of like surprise bills. Like it's not okay. So anyway, so I pay my $1,300 and off I go. So anyways, a month later, I needed another MRI. And so, I don't have a traditional healthcare background. I have a consumer background. I'm an engineer. But I'd like to think, I'm a good problem solver, and I like to make sure that we're thinking things through. So my doctor says you need another MRI. I'm like, okay, I know I'm going to get a bill in the future. So why don't we skip all of this? And can I just pay for it directly? And so I went and talked to the MRI team, and it's the same doctor, same MRI center. I said, look, I'm just going to pay for this directly. They're like, that's great. I can get you in tonight. I was like, what? Like, there's no waiting. There's nothing. No, I'll get you in tonight. And I'm like, okay, let's do it. She's like, but I'm going to have to take payment right now. I'm like, no problem. So brought out my Visa card, and she rang me up for $330. And so my wife says I have an overdeveloped sense of fairness, which I actually kind of appreciate. So I literally said, I love that you're charging me $330, but I was here a month ago and you charged me $1,300. So that I'm not billed later, can you just bill me the full amount? She's like, yeah, I don't know about all that. That was what your insurance company had negotiated with our network. But if you pay me directly right now, it's $330. So I paid that, got my MRI. And the whole time I'm thinking, oh my God, why is this working this way? So by paying the doctor directly, I was able to shorten the time to get care by weeks, right? Originally, I had to wait 2 weeks to get to get the MRI. We skipped extra procedures. I didn't need to do the CT scan, and it ended up being cheaper and no surprises. And that was the aha moment for Sidecar Health. I literally went back to my co-founder, Veronica. I remember running back to the office the next day going, I don't know if this is a thing or not, but you can actually pay doctors directly for healthcare. And when I did it this way, it was less expensive. And I eliminated all these other costs and waiting time. We should think about building a health plan.
Take us through a hypothetical, that same scenario, but through Sidecar. So I've paid my whatever, let's pretend it's $100 match or whatever it is to see the doctor. Doctor wants to get a CAT scan and or MRI. Take me through the story now, but I'm with Sidecar.
Yeah, so it's exactly what you'd want it to be. You go see the doctor. You know what the price is before you go, and you know you're going to get paid $1,250 for seeing this doctor. So already you're like, hey, this is pretty good. I know what I'm in for, and I'm getting paid to go get care. So I'm in the doctor office. The doctor's like, okay, your back's been bothering you. We need to get an MRI. And here's what'll happen is like, we probably need to get a CT scan first because that's how insurance works. And what you do is you say, not on my insurance. Let's go get that MRI. And the doctor says, okay, great. So here's the MRI order, and you go and you can look in the app at where all the different MRI places that you can go get that particular MRI. So you can choose, and you're going to go and you're going to see, okay, there's somebody down the street that will do it for whatever, for where I'm going to make $100. And so you go to that place, or you have them call in the MRI order there, however it works. And then you go to that place, you would go and see that doctor, you'd pay your $100 and get your MRI there.
So So let's say it's a MRI place charges $450. You guys are giving $350. I pay the $100 difference. It's a lot better than $1,300, or $350. And if the doctor wanted to see that CAT scan, and let's say the CAT scan was in the doctor's office, because sometimes it is, what happens there? Is that covered as part of my visit?
Yeah. So and typically, so there's things that will happen in the office visit, like a vaccine, lab draw, usually. Those are all part of the 50. Extra services like an MRI, like if this was an emergency situation where like, oh, we think you have a head issue, we need to see, that's like an emergency situation. And yes, that's going to be covered. But typically it's like in my case we're using, so I was having back pain. Like, I don't know exactly what we need to do. We need an MRI for diagnosis.
Totally understand the MRI is separate and charged separately. But what about the CAT scan? If let's say the CAT scan did make sense to do first, let's say this is the first go at it. And
so again, I'm not familiar with what a CAT scan is per se. So like an X-ray, like I went in for a broken arm and they need to do an X-ray. Yeah, that's included in the visit.
That's okay. Yeah, this is so cool. I got this is a really cool how you came up with this or what inspired you. Makes total sense. And what really makes it cool isn't so much that you were so innovative. It's like all of us, millions of us, went through that same experience you did, and none of us thought, damn it, I'm going to create a health plan that fixes all this. So kudos. Now, when you first started explaining this model to your friends, to your work colleagues, like your business associates, what did they tell you would never work? Because I'm sure you got to like, no.
I'll go a step farther, okay, which makes this fun. So I grew up in a healthcare family, even though I am not I'm not a healthcare guy. Again, I'm an engineer. And so one of the first people I kind of tested out was my father, who's a surgeon and one of the pioneers of IVF, in fact. And his first thing was like, this is never going to work. Like doctors you can't pay doctors directly. You can't pay health systems directly. So there was a whole finance process, like we just seemed unbelievable. Right. And then the second thing, of course, that follows is like, well, providers you have to have a network, right? Like how would this work? So at every single point along the beginning of this journey, it was just, that can't possibly be true because we've all been trained one way. Right? We've all been trained one way. In fact, one of the early investors that I met with once when we were out raising money for this idea after it gained traction is kind of unbelievable. It was a healthcare investor. And the healthcare investor, after I kind of explained in the model how we were thinking, was like, look, Patrick, healthcare is hard. So before we invest in your healthcare company, it seems like you had a good track record with consumer companies. I will invest in your healthcare company after you can prove to me that you can do really hard things. So I tell you what, why don't you go take the next 6 months and build a better search engine than Google, and then come back to me and I'll invest in your healthcare startup idea. And what he said to him, I said, like, look, you could just say no, right? Like you don't need to be mean about it. And that's when I realized that the way the healthcare system has been built, everybody is trying to increment to better. Everyone's trying to come up with like the next point solution that solves this problem. No one is stepping back and fundamentally reimagining the system, which is a problem because we all know the existing system isn't working.
So tell me this. So you get your father, the naysayer, you get some investors, the naysayer. Why were they wrong?
Well, they were wrong because you can't stop market forces. They were wrong because providers are struggling to collect money. If you show up and say, like, I need a knee replacement and I will pay you $50,000 because that's what you're asking me for and I'll pay you right now, of course you get care, right? People come from all over the world to use our healthcare system because we have incredible doctors. Do you think they use their insurance? No, they pay, right? And so it's just a fallacy to think that people, like, health systems are not set up to take money because that's the first thing they do when you go see them, even if you're on a traditional network-based plan, they collect your copay.
All right. So 2 reasons why they were wrong. 1, consumerism, and 2, cash flow, like transactional cash flow. Point of sale is just a better way of collecting your cash than going through a third-party carrier and all the things tied to that. Those are the 2.
I think the other piece that's worth kind of mentioning in terms of, and I don't want to say they were wrong. It's not that people are wrong. It's just that, like, they didn't realize what was possible.
Well, sure they were. They were wrong. They told you it wasn't going to work. So,
well, it turns out it does. So,
yeah.
But the thing that really allows it to work is better data and better technology. Like the product that we've built is really incredible from a financial services perspective. When people swipe and pay, we validate in real time that they have active coverage before delivering cash to the provider. Like that's hard to build. To build an ability to price and provide guarantees on every doctor in the US, it's never been done before. to people will tell you that healthcare is really hard and really complicated. We've made it simple so people can make decisions, and that's hard. So we're an insurance company. We can take risks. We can create bundles. So you have to do the work to make it simple so consumers can make decision, and that is hard. But it's doable. We've done it, and now, frankly, everybody's going to copy us.
I want to get into the economic reality and your commercial, your go-to-market. But before I do, I have to ask. I want to stay on this topic. So I asked you. Why, the people who are the naysayers, why did they tell you it wasn't going to work? I asked you why they were wrong. Was there ever a moment, maybe there still is, when you thought, wow, they may be right?
Oh, Eric, I don't know if you've ever built a company from scratch. So
I'm doing it. You're talking to you.
You are. So you know the answer to this question. So every single thing that you do, like there is obstacles everywhere along the way, 100%. So, I've been surrounded by an incredible founding team. My co-founder is incredible. We built an incredible leadership team to fill out all the gaps that Veronica and I have with really incredible leaders. How do you price this product in a world where we have an incredible actuarial team, but we don't have the traditional data that everybody else has with all of the data coming in. So you actually have to make assumptions around how you price. So at every single point along our journey, we've had to actually make a bet, go and try it and be wrong, learn and do it again. Right. And so, 100%, like every day. And anybody that tells you that they're building a company and everything's up and to the right is not telling you the truth.
Not telling you the truth. No, for sure. All right. So I love this. And I love the whole methodology, the philosophy here. And everyone I think is probably nodding as they're listening. But employers, especially big ones, they don't switch carriers from the tried and true and tested because of a philosophy. They switch because of the economics, because of the quality. So what's the financial case that actually gets a CFO at an employer group to say, we're going to switch out of traditional health plan and move to this thing called Sidecar?
Yeah, well, this is the easy part. So we save 20% on medical costs, period. So both our internal data, external third-party data, we save 20%. In fact, a lot of the studies that are coming out are saying we're saving more than that. But we will tell you we'll save 20%, we'll stand by it, and that's what you're going to get on our plan, right? And so that means if you're a fully insured member, you're going to expect our premiums to be comparable premiums are going to be 20% less. So if you're a CFO, it's easy. In a world where there's so much frustration around increasing costs, where the Wall Street Journal article just a few months ago saying this year is the biggest increase in 15 years that employers are bearing. They're looking for solutions, and the only solution they've been given by traditional network-based plans is to push more costs to the employees or to narrow the benefits and coverage and access. And so we are the solution to an unsustainable economic environment for a CFO, and the solution to HR people that don't want to take anything away from employees. So that's how, it's an easy value proposition.
Okay. And would you say for the member, and tell me if I'm jumping the gun here, it sounds like if you are relatively healthy, you're on a couple of drugs, you see your PCP once a year, maybe a sick visit, maybe you've got a specialist visit every other year because of a knee, a back. It sounds like this is going to be a winner for her or him. What happens if I've got sort of chronic conditions and I'm a frequent flyer because of my health conditions? Remember, I'm commercial. I'm not even talking about Medicaid. I'm not talking about a frequent flyer in the ED. I'm just talking about frequent flyer in the healthcare system.
A chronic user that uses a lot of healthcare, right? As we get older, we all use more healthcare. This is what happened. So one of the big fallacies around Sidecar Health that people that don't know us automatically assume is this sounds like an amazing plan for the young and healthy.
Right. That's
right. I'm not saying it's not, right? Yeah. But where it really shines is actually the people that use a ton of care. Because the people that use a ton of care, you're talking your frequent flyers, they are frustrated. They are spending huge amounts of time trying to get access to care. They're trying to, there was a Kaiser Family Foundation report that came out that talked about denials by traditional network-based plans on the ACA. And they basically stated that within network, that traditional health plans are denying 19% of claims. 19%. Eric, do you think they're denying the office visits? No. Right?
Yeah.
And in fact, there's this craze. It created you guys can go kind of Google this up and look at it. Like, there was a lot of outrage that came from this report. And then you had the big insurance companies coming out and saying, wait a minute,
Patrick, what's the name of the report? Because we'll put a link to it.
You have to look it up, but it's Kaiser Family Foundation put out the report. I can send you a link and we can get it all synced up.
Great. Let's do it.
But it's easy to find. But a lot of the big insurance companies came out and said, wait a minute, we're not 19%. Our actual denial rate was 10%. It's like, well, hold on. Did you just say your denial rate's 10%? How are we okay with this?
Right.
How are we okay with this? Like, it shouldn't be that situation. So like, so when people assume that because we're all tech-enabled, like 100% of our members start their care journey on our app. Yes, we're a tech-enabled company, right? It's the difference, and I know you don't love this analogy, but it's the difference between taxis to Ubers. It's a change in the way that healthcare. There's nothing wrong with taxis. It's just that, like, Uber's a different experience. And so, yes, young people are more used to using the phone, but the people that use more care, they get so much more value because they can now see the doctors they want to see. They're not having to fight to get access to the tests that their doctors say they need, that they don't have permission to get access to, right? So, like, actually, if you look at our actual populations, our populations tend to be sicker than average. And the reason for that is, maybe it's not intuitive to start with, is the companies that have populations that are sicker are getting bigger increases. And so they're more acute to, wait, how do we solve the economic problem? So they're the early movers.
Oh, wow. So like and I know you operate, you're a full stack carrier, taking on the risk. Talk to me a little bit. Here's my little VCPE question. Talk to me about your reinsurance strategy and how do you protect the balance sheet while still pricing aggressively and making it worthwhile both for the employer and the employee?
Yeah, well, by the way, first of all, we have an incredible CFO and chief actuary who was a former chief actuary at HCSC and a former chief actuary of Florida Blue. So like, he is driving all of that. So our team breaks up into 50% of our team is consumer folks. That's kind of my side of the world, and 50% of our team is deep healthcare folks, and it's a great balance.
Yeah, I love that. More healthcare companies have to do that.
They have to, because these are people that are dealing with them. Consumerization is the only way that we're going to solve this, and you need both. You can't have just healthcare people that have dabbled in consumer. Like, it says consumer people, because every consumer person has definitely spent time in healthcare because they use it.
The input layer of healthcare is not good. We got to bring outside industry. Yeah, I'm with you on this.
We like to joke that the consumer folks on our team are unencumbered by experience in healthcare, and that leads to better decisions. All right, so let's talk about how do we protect the business. Like, we are an insurance company. We take risk, and those risks have to be made smartly. And so, yes, we're small. We're new, so we reinsure. All right, and so basically, the way we do is every year we look at kind of our claims, we look at kind of the size of the business, and we basically determine where we want to reinsure out claims. So right now, I think we reinsure out claims over $400,000, right? And so every year we kind of make that go up and up and up based on as we continue to grow and our balance sheet continues to grow.
Got it. And that protects you from the long hospitalizations and all the other just life happens stuff.
Yeah, I mean, again, it's an insurance company. You know what you can expect around utilization. You know what high claimants are going to be, and so you build reinsurance on the back end. And as you get larger, you use less and less reinsurance. This is why, like, large self-funded employers, they don't buy stop loss, but small self-funded employers buy stop loss.
What do you do about supplemental? Like, do you integrate digital solutions? You seem to be.
This is interesting. Okay. Yeah. So every single employer today has been trained that, look, you have problems with your health plan. Let's solve that with point solutions. So whether it's a Hinge Health, whether it's a Livongo, like all these things to try to manage the cost of your high cost claimants better. Well, I'll first say, like, the reason you need those things is because your health plan is failing you, right? Like, if it was doing its job, like if the incentives were aligned, you wouldn't need to try to augment it. So I'll start there. But on the second point is, again, we're Switzerland. If a company has invested a ton in a particular point solution that they really love, that they really does work for their population, that's great. We'll just integrate it in. So when someone's looking for physical therapy, we can actually bring up and say, hey, have you considered Hinge Health? This is how much Hinge Health will cost on Sidecar Health, or how much you'll get paid to use Hinge Health on your Sidecar Health based on how the pricing is. Like, literally, for anything you want to get in healthcare, we can actually make any doctor available or any solution available right in the app for our members.
But you guys yourself aren't including any point solutions or digital solutions into your benefit program. Like,
we cover everything, and including coverage for those point solutions. So, like, for example, like physical therapy is covered. If you decide to use Hinge Health for physical therapy or Sword, great. That our benefits will cover those.
Copy. And so, what about virtual care, virtual primary care visits? Like, are you using?
Yeah, again, we're agnostic. If you want to do virtual primary care, you should do virtual primary care. Like, it's literally whatever you want. We cover the service, not the provider.
Right. So if the provider, it's almost like direct primary care. If the provider says to me, "Hey, Eric, on your follow up, we could do this, and we'll bill you for a video visit,"
Sure.
And then you guys have the pricing on that. You have an allotment for that. Okay, makes total sense. All right. Really, I know we're running on time. Are you okay going a couple of minutes over? I have so many questions. I'm loving this. All right. So let's get to, because you seem like you're really, and tell me if I'm insinuating incorrectly, you're really into the UX and the consumer experience. Not just the experience we have in the office, but just the experience I have in the app. Everything has to be really easy, right?
Yes.
And so and then with all that, what did you learn maybe the hard way about all the consumer behavior when you move people from traditional insurance into this like, I don't know, this new transformation? Like, everyone uses transformation in their marketing when go, this is truly transformative. So what did you learn the hard way? Like, what assumptions about consumers maybe did you have to revise?
Oh, okay. So we learn every day. So one of the biggest learnings that again came from one of our employers was to let people try the product before they enroll. Right. So, like, we basically have an app where you can look up doctors, you can look up benefits, you can look up your pharmacy, etc. But believe it or not, we didn't actually expose that to people until they were members. And so people basically joined us on this conversation, right? Like, oh, this sounds amazing. Yeah. We would show a demo, they'd get a sense of it. They never could look up their own doctor because they didn't have access to the app. Now, again, for those listening, and I'm sure, Eric, for you, it's like, duh, you should have a pre-member experience. So that's one of the big learnings we had, is like, let's open up the app for people that are considering enrolling so that they can look up their doctors, their pediatricians for their kids.
Yeah.
And it changes everything.
So we can all download Sidecar right now.
You can't. So we don't do that yet, and we should look at that. But for employers that are talking to us, we make it available to their members as part of the discussion. Whereas we don't sell directly to consumers, so you can't just go download the Sidecar Health app and get access.
Well, wait a minute. I'm the CEO of a small company, so if I said to you, I want to look at it, then maybe
what we would do is we would make it available to you and to all of your employees, and you guys could go play with it. And that's been game changing for us, because it's the fear of the unknown. Everybody knows, like, people might not like it, but everybody knows that, like, on the existing system, like, if I just go to the doctor and if I stay with the network, I just pray it's going to all work out. And, like, that's what I know. And so now you're saying, Patrick, that I got to go to an app and I got to look at my doctor and I got to be engaged in my healthcare decisions and I'm going to know pricing. And that's different. And it seems scary because it's different. And so simply by giving it to people, it suddenly becomes not scary at all. And it kind of becomes like the red pill. You don't want to go back.
Got it. So it's just like everything, right? We have to kind of see it to believe it.
You got to see it to believe it.
And so that was one big assumption you had to revise, or at least one learning you had. Any another one?
The other one that we had is deductibles were interesting. So when we originally rolled out our product, we didn't make deductibles an option because deductibles are confusing. Who wants deductibles? You know who wants deductibles, Eric? Employers. Right? So employers want to manage cost. They want to have deductibles. They might have a $1,500 or $3,000 deductible on their plan. Our original plans did not do that. And so we kept getting asked by employers, hey, I want a deductible plan to manage costs. So what we did is then we introduced a new product that actually had deductibles that employers can choose. But we basically made a bunch of the services employees want to be available pre-deductible. So for our standard plan, even though the employer might choose a $3,000 deductible, no office visits, no specialist visits, no mental health visits, no telehealth visits, no pharmacy hits the deductible. So it's like a win-win. Employers get to have lower costs because they have deductibles, and the employee is a win-win because they have lower costs, but actually for the most of the stuff that they need, it doesn't even hit the deductible.
Surgery is
would hit deductible.
Yeah, of course, right. Got an inpatient, all that. Okay, great. All right, I love this. So listen, we've talked about the mechanics. I think we all have it. You've explained it unbelievably well. We've talked about the incentives. Everyone should have that. We've talked about the risk and managing the business. We've talked about everyone should have that in their head. Now, ultimately, the bets, if we were investing in this company, it's not just about the quarterly performance. It's about does this work? Is it the right model? So 5 years from now, Patrick, if Sidecar wins, what is fundamental? When Sidecar wins, I'm with you. I'm a buyer. I'm a buyer. So when Sidecar wins, what has fundamentally changed in how Americans experience health insurance?
Well, here's the thing, and here's what's so interesting. My biggest challenge isn't whether or not Sidecar Health wins or not. My biggest challenge is how do we make sure we are the sidecar that wins? And the reason why I say that is because our advantages are so big for people and patients. They're so big for employers, and they're so big for providers that everybody has to copy us. Like our model and the consumerization of healthcare is where the world is going. You can even see it in regulatory changes. It's moving our direction. So I know that ultimately a 20% cost savings on a market on the 20% of the US GDP is such an advantage that I'm sure this model is the future. So I don't know that it's going to take, I don't know that 5 years everybody's going to copy us, but I will tell you 15 years from now, every single health plan that exists is going to be on the Sidecar Health model. And there's going to be a bunch of people competing, just like everybody's traditional plan is all the same with different brands.
Yeah.
I just want to make sure we're the biggest one of them.
Sure. So, okay, you guys are kicking butt. Who loses? What part of the legacy model disappears first? Because even though I agree people will copy you, if you're doing your job, you've gained enough market share, you've gained enough funding, you've done enough land grab, maybe a few people copy you, but ultimately some people are gonna fall off the tree and die after that, so to speak.
I think the people that lose are the payers that actually do not adapt their model. Right. It is so obvious that the demand is for consumers to actually be in charge more of their healthcare. It's consumers and doctors, transparency, choice. That's where the world is going. And all the big insurance companies know this. I think they struggle with how to actually start making these changes, but they're all thinking about it. They all do announcements about new plan designs that are consumer driven. They're all recognizing the problem and trying to move this direction. The people that will lose are the ones that actually can't make the transition. Right. I would be more worried if I'm a big established legacy insurance carrier. I'm more worried about the big technology companies that look at us and say, wow, this is 20% of the US GDP. I want to launch my own Sidecar Health, and they enter in from the consumer side.
I'm waiting for that. We've seen big companies a lot bigger than yours try to do that.
Yeah, but they tried to do it. I mean, again, everyone's got great intentions, but they tried to do it by incrementing. You can't stay within the constraints of the system that are false and expect a different outcome, or you have to change those constraints. So we know the greatest value finding force ever created is the consumer. So if you can unleash that, that's when you win. We've just been the first company that actually made it practical and easy for people to do.
Great stuff, man. I mean, what you're describing is so transformative. It's not a product tweak. It's a decision about how insurance should evolve. And that's what I love about it. I believe industries don't transform, especially our industry, because someone negotiates harder inside the same structure. It actually changes when leaders are willing to rethink the incentives, redesign how all the products work. And that's what you're doing, right? I mean, I'll sew it up. Transparency, I think, changes the behavior. And then the question isn't whether one model wins over the other, it's whether the next era of health plans are willing to adapt their designs to the price-aware, more engaged consumer, right?
That's right.
All right. This was awesome. And you
look, just a wrap-up thought. Think about every industry. Every industry goes through transitions. Healthcare's just been slower, but like whether this is Blockbuster to Netflix, whether this is like electric cars, whatever this transition is, like it's coming for healthcare. The technology has gotten to a point where it enables consumers to do what they want. And so it's time.
Taxes, music industry, you're right. We could go on and on.
Taxes, yep. Back to taxes.
Yeah. Big thanks for walking us through this. All the structured bets behind your vision. This was awesome. And for the leaders listening, this isn't about sides. I would say it's about trajectory. Like every organization is deciding in its own way how to evolve. And I think there were so many things during this conversation, so many bright spots that should inform all of you in your meetings, in your boardrooms, how you should evolve. Because at the end of the day, at least what this show is all about is enabling all of you to make healthcare better for all of us. So hope you enjoyed this episode. Patrick, great job. And as a reminder, everyone, subscribe, share it with your friends, tap on those 5 stars, more of your peers. Find the show that way, and you get more insights from all the leaders that come on this show. It helps everyone make healthcare better for everyone. This is your Bright Spots in Healthcare podcast. Take care, everyone.